Welcome to the Deep Dive. We take stacks of information, dig through them, and pull out the key insights so you can get truly well-informed. Today, you've brought us a really challenging topic. Incredibly important, though. We're looking at the escalating attacks on healthcare facilities, personnel, too, in conflict zones. We'll focus particularly on the Gaza war, but look beyond that as well. So our mission for this deep dive, basically to understand the legal protections, the rules made to keep hospitals, medical workers, ambulances safe, and then compare that with the, frankly, harrowing realities we're seeing on the ground. We'll also explore the wider humanitarian impact and, crucially, get into the implications for accountability. It's complex. Legal stuff, heartbreaking stories. But we'll unpack it.
That's right. And we've got a powerful range of sources: detailed incident reports, international legal texts, humanitarian updates, analyses looking at the sort of systematic nature of these attacks. What's really striking, I think, is how these sources don't just document the scale, which is tragic in itself. They also really shine a light on these urgent questions about, well, is anyone actually following international law? And what about accountability?
Okay, let's dive right in then. Maybe start with a very stark recent example, something that brings it all into sharp focus. The attacks on Nasser Hospital in southern Gaza. What do the sources, like, say, Al Jazeera, tell us happened there?
Yeah, the Al Jazeera report, it paints a really vivid, horrifying picture. It describes powerful Israeli strikes, but people just running for their lives, men, women, children. But what's truly harrowing is this detail of a second Israeli strike in the same spot. Yeah, causing, quote, further catastrophic damage, distress, and death. And it hit emergency responders. This is what's often called a double tap strike. A second attack targeting the people who rush in to help after the first one.
A double tap strike. Wow. Targeting rescuers. That sounds particularly awful. What does that imply? Especially when medical staff, even journalists, were among the casualties.
It's deeply concerning. The casualties were significant. Medical staff and rescue workers, yes, but also specifically members of Gaza's media, people like Al Jazeera's Mohammed Salama, Miriam Abu Daqqa from AP, Hussam al-Masri, a Reuters cameraman. The description is just horrific, burned, and many of them are in pieces. Now, our sources, Yonhap News, Al Jazeera, they note the Israeli military ordered an investigation, said it regrets the deaths of uninvolved civilians. But they didn't confirm a direct hit, didn't address the two strikes, or explain the objective. And, there's a Florida Law Review article that argues this kind of double-tap strike is, quote, likely a war crime because it just grossly violates the Geneva Conventions by targeting responders and the wounded.
That incident at Nasser is just incredibly difficult to process. And you said it's not isolated.
Yeah.
What's the wider pattern here that our deep dive is showing?
Right. If you connect Nasser to the bigger picture, it unfortunately fits into a much broader, almost systemic pattern of assault on healthcare. The scale is just staggering. Yeah. The World Health Organization, the WHO, verified by April 2024, 906 attacks on healthcare. That's across Gaza, the West Bank, Israel, Lebanon. Yeah. And more recently, June 2024, WHO figures show Israel attacked 464 healthcare facilities, killed 727 healthcare workers, injured 933 more, and damaged or destroyed 113 ambulances. If you focus just on Gaza, WHO reported in September 2024 492 attacks on healthcare there. 492 people killed since October 2023. Think about this. As of May 2024, only 4 out of 36 hospitals in Gaza hadn't been damaged, raided, or basically forced to start working. Only 4.
Those numbers, they're not just statistics, are they? They paint this picture of a health system under constant, widespread siege. It's the pattern that seems critical here, this erosion of medical care. And it's important to note, our sources mention it's not just one side. Physicians for Human Rights accused Hamas back in October 2023 of assaulting medical personnel, blocking emergency teams, even killing some trying to provide care.
Exactly. It's the infrastructure, yes, but it's also the people, the ones dedicated to saving lives. The International Rescue Committee, IRC, stated in August 2025 that since October 2023, over 500 aid workers and at least 1,500 health workers have been killed in Gaza.
1,500 health workers.
And get this. In the first 6 months of 2025 alone, over 70 aid workers killed in the occupied Palestinian territory. It looks like it's tragically going to surpass Afghanistan as the deadliest place on record for aid workers. That should really give you pause.
Okay, we've laid out this devastating reality, the numbers, the specific incidents like Nasser, but this just screams the question, doesn't it? Given this scale of destruction, what does international law actually say? What are the rules meant to protect these vital services?
That's exactly where we need to look. International humanitarian law, IHL, the ICRC details it pretty clearly. Medical personnel, hospitals, ambulances, they must always be respected and protected, period. The law is explicit, willfully killing the wounded and sick, causing great suffering or serious injury. Those are war crimes. And the emblems, the Red Cross, the Red Crescent, they're visible signs of this protection. Attacking someone or something displaying them is also a war crime.
Well, the protection is strong, but is it absolute? Are there conditions where a hospital might lose that protection?
There is one critical condition. Protection can be lost if, say, a hospital is used outside its humanitarian function to commit acts harmful to the enemy.
Like sheltering fighters or storing weapons.
Exactly. But, and this is crucial, the protection can only be withdrawn after a due warning has been given, with a reasonable time limit, and only after that warning has gone unheeded.
Okay, a warning, a time limit, and then it has to be ignored. That seems like a pretty high bar. Does our source material suggest those conditions are, consistently met?
Well, that's precisely the friction point our sources highlight. It's a very high bar.
Yeah.
Now, the IDF has consistently accused Hamas of using hospitals militarily for attacks, weapon storage, sheltering fighters, tunnels, human shields, even holding hostages.
Right, we hear those claims.
But Human Rights Watch, for instance, stated explicitly, the Israeli government has put forward no evidence that would justify stripping hospitals of their special protections.
So the claims are there, but the evidence required by law, maybe not. That's where it gets really complex, this clash between the legal standard and the accusations.
Exactly, and you see others echoing this. Andrew Cayley from the ICC, back in December 2024, commented that Israeli claims about Hamas using hospitals were grossly exaggerated. Now, the New York Times did later suggest Hamas stored weapons and used tunnels under al-Shifa.
Oh.
But crucially, it also noted the Israeli military struggled to prove that Hamas maintained a command and control center under the facility. So it points to this potential gap between an accusation and the kind of concrete proof needed under IHL to justify removing that protected status.
And it's not just hospitals, right? We see similar issues with ambulances. That al-Shifa ambulance strike, November 2023, 15 people killed. The IDF claimed it was transporting Hamas fighters and weapons.
Correct. But again, Human Rights Watch investigated and said they did not find evidence that the ambulance was being used for military purposes. They suggested the attack could be a war crime.
And Doctors Without Borders.
They called an attack on their convoy around the same time a deliberate attack.
So even if, hypothetically, a hospital did lose its protected status, which sounds hard to prove legally, what happens then? Are the people inside fair game?
No, absolutely not. And this is critical. Even if protected status is lost, IHL is crystal clear. The civilians inside, doctors, nurses, patients, even wounded fighters seeking care, they remain protected. They cannot be targeted.
Okay.
And the key principles of precaution and proportionality must still apply.
Can you quickly unpack those for us? Precaution and proportionality.
Sure. Precaution means the attacker has to do everything feasible to avoid or minimize harm to civilians, like assess a target carefully. Proportionality means the expected military advantage can't be excessive compared to the anticipated civilian harm. If the civilian cost is too high, the attack must be canceled.
Right.
And again, there should always be an effective advance warning to allow evacuation if possible. These aren't optional extras, they're fundamental rules.
Okay, so we have the law, we have the claims, we have the devastating reality. What does this all mean for the people actually caught in the middle? The impact must go way beyond just the buildings hit.
Oh, absolutely. The sources paint a picture of a complete healthcare collapse, a humanitarian crisis that's almost unfathomable. An OCHA report from August 2025 puts it starkly. Every hospital in Gaza is either damaged, destroyed, or out of service due to lack of fuel. Every single one.
Every hospital.
And the WHO confirmed in September 2024, only 17 out of 36 are even partially functioning.
When you put those together, it's not just a breakdown, is it? It feels like the systematic dismantling of an entire health system.
Yeah.
Like it's designed to fail the population.
That's a powerful way to put it, and it aligns with what some sources suggest. It's not just collateral damage, it's the erosion of the very possibility of public health. This creates generational scars, a profound sense of despair, makes recovery so much harder even if the fighting stops.
What are some specific examples of that collapse?
Well, critical medication shortages. Think about 71,000 diabetes patients, 2,500 with type 1 needing insulin, with maybe only a month's stock left. Basic stuff for hypoglycemia running out. We're seeing more amputations because antibiotics just can't fight off the bacteria anymore. Two-thirds of samples from Al Ali Hospital over about 9 months showed multi-drug resistant bacteria.
Superbugs, essentially.
Yes, rehabilitation barely exists. Only 40% of facilities partially working. One workshop making or repairing artificial limbs. Lab services. Nearly half the test materials gone. Critical tests for operating rooms, intensive care, kidney transplants, even blood screening running out. That means risky blood transfusions.
And wasn't there something about reproductive health care?
Yes, a UN investigation in March 2025 concluded Israel committed genocidal acts by systematically destroying reproductive health facilities, including the Al Basma IVF Center. 4,000 human embryos were destroyed there.
4,000. It's hard to even wrap your head around that. Destroying embryos at an IVF center, kids suffering psychosocial distress. It's not just data points. It feels like the future of a community being attacked.
It's exactly that. It's targeting the most vulnerable, the potential for future generations. The sources suggest these aren't just tragic side effects. They can be part of a strategy with long-term, devastating societal impacts. And this health crisis, it's happening alongside a broader humanitarian breakdown.
Like hunger.
Hunger, malnutrition. Worse than ever since October 2023. OCHA documented 269 malnutrition-related deaths, 112 of them children. The number of acutely malnourished kids needing care doubled in July compared to June.
And water. Sanitation.
All wastewater plants stopped. Sewage going into stormwater basins, into the sea, huge pollution, public health risks. Water use dropped 92% from pre-conflict levels. 70 desalination plants were targeted.
You mentioned the impact on children earlier, too. Child labor, begging.
Yeah, a noticeable rise. Widespread psychosocial distress. And crucial child-focused supplies haven't been allowed in since March 2nd, 2025, according to the sources.
And it sounds like getting any aid in is a massive problem itself. Aid obstruction.
Absolutely. Over 100 international NGOs sounded the alarm in August 2025. They said most major NGOs haven't been able to get a single truck of life-saving supplies in since March 2nd.
Why? What's blocking it?
New registration processes, demands for sensitive staff data by Israeli authorities, according to these NGOs. Human Rights Watch, back in March 2025, also reported Israel blocking all aid, calling it a flagrant violation of international humanitarian law.
Okay, so we see this systematic dismantling of healthcare, the massive humanitarian cost, the obstruction of aid. It all forces us back to accountability, doesn't it? You mentioned that double-tap strike concept earlier, hitting emergency responders. A potential war crime.
Right. And if you connect that specific tactic to the wider pattern, one source, Justice in Conflict, notes attacks on hospitals have become almost daily occurrences in various conflicts: Gaza, Ukraine, Sudan, Israel. It suggests a normalized targeting of medical care.
Normalized targeting. That's a chilling phrase.
Yeah.
Why would this happen? What reasons do the sources give for this pattern?
The source posits a few deeply troubling reasons. One, a simple lack of consequences. People get away with it. Two, healthcare workers often witness atrocities. They can provide testimony, say, to the ICC, so silencing them might be a motive. Three, a potential belief in collective punishment. And four, maybe a desire to inspire terror. The logic being, if hospitals aren't safe, nowhere is safe. And compounding all this is often a stark absence of independent international investigations.
But hold on, isn't there a risk that focusing only on lack of consequences might seem simplistic? Given the chaos of urban warfare, do the sources acknowledge the difficulties forces face, maybe offer alternative reasons why these attacks happen so often, beyond just impunity?
That's a fair point. The sources, particularly those dealing with military operations, do acknowledge the complexities. Urban warfare is incredibly difficult. Distinguishing combatants from civilians is a huge challenge. However, what the Justice in Conflict source specifically argues is that even with those complexities, the consistent outcome, the sheer volume of attacks, the pattern of hitting aid workers, the lack of credible, independent investigations afterwards points towards a systemic failure. It's less about judging the intent in every single strike, perhaps, and more about looking at the overall pattern and the glaring failure of accountability mechanisms to function effectively when these things happen repeatedly. The system isn't stopping it.
Okay, so if the system is failing, what does genuine accountability look like? What are the calls for action?
Well, Human Rights Watch, for example, back in March 2025, called for concrete steps. Suspending arms transfers to Israel, supporting the ICC, which, as you know, has issued arrest warrants for top Israeli leaders, and imposing targeted sanctions on officials deemed responsible for war crimes.
So state-level actions, international court actions.
Yes. And the Justice in Conflict perspective broadens it out. It argues accountability should be pursued by, quote, anyone and everyone with the capacity to do so. That could mean individual countries opening their own investigations under universal jurisdiction principles. It could even mean looking into the complicity of companies supplying weapons used in these attacks.
So multiple avenues.
Exactly. The point being made is that accountability avenues are endless for the simple reason that they have never adequately been pursued. The laws themselves, they're pretty clear. It's the application, the enforcement. That's where the system breaks down again and again, and that perpetuates this horrific cycle.
Right. This deep dive has certainly presented a sobering picture. We've looked at the international laws, clear rules meant to protect medical care, and contrasted that with these devastating accounts, attacks on hospitals, on healthcare workers, and then the cascading humanitarian crises that just ripple outwards.
Yeah, the scale of destruction, the human cost, it's undeniable. And that fact about the occupied Palestinian territory potentially surpassing Afghanistan for aid worker killings, that just underscores it tragically. The consistent pattern of these attacks happening despite international condemnation, despite clear legal rules, it really highlights this critical systemic gap between the law on paper and what actually happens on the ground, between the frameworks and their enforcement.
We've definitely seen how these aren't just isolated incidents. They seem part of a much broader systemic challenge that really demands our attention. So as you, listening, reflect on all this information, maybe consider this. The rules of war seem pretty clearly defined when it comes to protecting medical care. The human suffering is tragically evident. So what responsibility falls to us, as individuals, as a global community, to demand a different future for medical care in conflict zones, and crucially, to ensure there's real accountability when those rules are broken?